So revision ACL reconstruction is increasing, and the reason for that, of course, is there's more primary first-time ACL reconstruction being done, but also the incidence of ACL rupture is increasing. So as a specialist knee surgeon, we need a skill set to deal with the more complex redo work. The principles are, of course, exactly the same as with a first-time reconstruction. That is, you've got to get a good graft, you've got to put it in the right place, you've got to fix it properly. You may need to do extra surgery to help protect it, such as tightening up the outside of the knee, an operation called a tenodesis, or some people prefer an anterolateral ligament reconstruction, and also deal with other injuries in the joint, such as meniscal tears, because all of those will put stress on the ACL if they're not addressed. But the technique is more complex, it's much more challenging, and so the surgeon has to be very comfortable with using different types of graft, because they have pros and cons in the revision setting. They need to understand different types of fixation technique, whether they use screws or a combination of synthetic loops and buttons. They also need to understand how to do the peripheral surgery like a tenodesis, and they also have to be very skilled at repairing menisci. It's possible they might even need to consider realigning the bone if it was very malaligned, and we're understanding the potential need for that. They really need to understand injury prevention and encourage the patients to take that on board, because that will help reduce the burden of revision ACL reconstruction. And there are certain groups who are particularly high risk, and the trick is to identify them at the beginning and to counsel a patient, and often as their children, their families, as to the risk of redoing their ACL being high, and also the opposite knee. And in certain patient groups, there's about a 1 in 4 risk of them rupturing their other ACL. And so that committing to rehabilitation, understanding the importance of that via the education from the surgeon is critical.